It's not uncommon in our health system that the folks in the ER or surgery or the ICU know definitively that they did something to save someone's life. But I think so much of our health system now is outpatient based, and we're doing the right things. We're being preventive, and we're trying to keep people out of the hospital, and that's great. But sometimes all those folks working in those realms, it's not as easy for them to see that they've saved someone's life. I actually cared for Chaz when he was a teenager. His family came in to see me, and he was heavy then. And he was felt awkward then, felt uncomfortable around people, was feeling pretty depressed. Tried to work with his mom to help him get the motivation he needed to lose weight, and his family wasn't as motivated to help him as I felt. I was the motivated one. Everyone else didn't seem to want to do anything. And then actually he literally dropped out, and I lost him for 2 years. And one day he just shows up in my office by himself. I think he was probably at that age like 17, almost 18. And I said, Chaz, well, it's great to see you. I haven't seen you in a while. And I said, what are you here for? And he had watched a show on TV. It was either about the combination of depression and being overweight and how it can kill you. And he said, I just decided that's going to be me, and I'm going to die, and I don't want to die. It became pretty clear, though, 20-minute appointments with him and the resources he had in his home and with his family wasn't going to accomplish what we needed to do. So that's when I sent out this email in April 2011 to a bunch of people that I thought could help, and I just sort of said, you know, how would you like to help me save a life? That I have this patient that needs these things, and I can't do it myself, and he can't do it himself, and we're just looking for some ideas and help, and the response I got from that email was incredible. I think our revised mission statement has really sounded deeply in people. This working as one, you know, for a healthy community and provide exceptional care. And for him, this working as one really meant us reaching out to actually the visiting nurses were involved for a while, our own behavioral therapists, the athletic trainers, and the physical therapists. And we really were working as one. Not only did we have the same goal around the patient and actually the patient's goals, but we were communicating really wonderfully. So whenever we saw him in the office, we would feed that back by email to the other people involved in his team just for feedback, so they knew what they were doing was making a difference, because they couldn't tell otherwise. And then they would give me feedback. Hey, just saw Chaz this week, you know, he's doing this or this, he's struggling there. Next time you see him, could you encourage him around this, congratulate him on that? So when Chaz came in, he knew that, again, we were working as one, and we knew what each other were doing, and I think that was a positive thing for him, to know that there was a community of people that cared about him. One of the things, you know, we don't always understand the barriers for care. We wound up finding out that all he had was some street clothes, and he didn't feel comfortable even going to physical therapy in street clothes. So our office decided to try to break that barrier down for him, and we went to the big men's shop and bought him a shirt and some exercise pants. And again, for a guy 500-600 pounds, that was nearly $100 for just those two pieces of clothes, and Chaz and his family could never have afforded that.
Since he's overweight, we have to modify a lot of the exercises for him. He can't get on most of the machines. So a lot of times, I mean, like one of the pretty much the biggest challenge was really just thinking of different modifications to do the same muscle groups to get him a good workout. So like that's why a lot of times I just have him do like little mini squats, and it's a sit-down stepper, so it doesn't seem like he's doing much overall. But for him, if you ask him afterwards, he's sweating. So it's a pretty good workout then if he's just sitting down and stepping, but he's sweating doing it. So that extra 5 or 10 minutes, he does that 3, 4, 5 times a week sometimes. It adds up. It's a good extra hour and a half sometimes. Various sit-to-stand exercises. That for him is a very good workout, which for most people that's nothing. From this standpoint, a lot of people just over the past couple of weeks and months, since I've been working with him for about a good 3 months now in total, they've noticed he is much more motivated overall. They see him working much harder and much more vigorous. Like our speech language pathologist, she again told me a couple things to work on with him to make sure I'm watching his breathing patterns and everything. So he has other people here as well, let alone me, that are actually watching out for him, even though they're not even directly working with him.
Well, I felt good. I really think this is working, these exercises, and then I got trying to eat better and just trying to stay focused. Yeah, it is a lot of hard work, but I'm up for it. Joe, on his own time, come in and help me out. I mean, he don't have to do it, but he's willing to come on his own time and help me out. So that's it. If we're gonna put an effort in helping me out, then I'm gonna put an effort. I'm not gonna waste his time. So just them being there for me, it shows that they care. And on my own, I would have done it. I'm doing this because I don't want to die young. I want to live a long and try to get healthier life. I was gonna settle for the life I had.